This module was created by Nipissing University's Best Practice Spotlight organization team based on the Registered Nurses Association of Ontario's Best Practice Guideline, Assessment and Management of Pain. The Nipissing University BSCN program is undergoing a pre-designation to become a Best Practice Spotlight organization. This project is funded by the RNAO in conjunction with the Ministry of Health and Long-Term Care. Disclosure. This presentation is based on the RNAO Best Practice Guideline, Assessment and Management of Pain. This graphic demonstrates how to use best practice guidelines based on your academic year. First year, knowledge of the best practice guideline and assessment using the best practice guidelines. This is also an introduction to best practice guideline order sets. In second year, clinical exposure to application of best practice guidelines. Third year is knowledge and use of best practice guidelines in complex settings. And fourth and fifth year is the application of best practice guidelines in complex scenarios, utilizing more critical thinking. This guideline outlines evidence-based practice that addresses recommendations for healthcare providers assessing or managing those who have pain and those who are at risk of developing pain. An overview of supports and appropriate structures are discussed in order to provide the best possible evidence-based care. This is a video created by the Registered Nurses Association of Ontario that looks at the assessment and management of non-cancer pain in older adults. What is pain? Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or describes in terms of such damage. Pain can be either acute or persistent, also known as chronic, or someone can experience both of these at the same time. Below you'll see the definitions for acute pain, persistent pain, and then it also describes nociceptive or neuropathic pain. Nationally, pain that is poorly managed places a burden on the person, society, and the healthcare system. The Canadian Pain Coalition's Pain in Canada fact sheet discusses how 1 in 5 Canadians rate their pain from moderate to severe persistent chronic pain, and 1/3 of those individuals are unable to work due to the impact that their pain has on their health along with their quality of life. Effective pain management. Every individual has the right to effective pain management. It is a top priority for healthcare providers to assess, intervene, monitor, and prevent/minimize further pain, whether their diagnosis or type of pain. A physical, socioeconomic, and physical burden is placed on an individual who has persistent pain along with a family or caregiver. Pain is complex, it is highly subjective and multidimensional with 3 components: cognitive, sensory, and affective. When caring for someone with pain, the process must be person-centered that allows for multidimensional approaches to encourage the involvement of spiritual, cultural, and biopsychosocial factors that surround the individual. When caring for someone with pain, it should be an interprofessional team effort. Nurses often work directly with individuals and they have a responsibility to intervene within their scope of practice when an individual reports pain and to work with them in order to manage that pain. That being said, nurses are obligated to assess and manage pain using competencies and evidence-based care. When should individuals seek assistance with pain management? Pain that is uncontrolled is a common problem in society and it can affect any age, including those who are unable to communicate. If pain is affecting these individuals and their activities of daily living, this can affect how they function and their behavior. This is because pain can cause individuals to feel distressed, especially if they are unable to communicate for themselves. Pain is easier to manage in the early stages before it becomes too intense to deal with. If an individual notices that someone they care for is unable to communicate their pain verbally, there are nonverbal cues to watch out for, including crying, facial grimacing, irritability, or silence. If you suspect pain, it is important to contact a healthcare professional. The purpose of this guideline. This best practice guideline is to assist healthcare professionals to become more confident, competent, and comfortable when assisting with pain management. This guideline uses evidence-based practice in order to assess, intervene, and manage an individual's pain using a client-centered method. The RNAO Expert Panel on Assessment and Management of Pain developed these guiding principles for this edition of the guideline. Any person has the right to expect their pain to be acknowledged and respected, the best possible personalized evidence-based pain assessment and management, including relevant biopsychosocial components, ongoing information and education about the assessment and management of pain, involvement as an active participant in their own care in collaboration with the interprofessional team, communication and documentation among interprofessional team members involved in their care to monitor and manage their pain. Best practice recommendations are provided in 3 areas. Number 1 is practice. Frontline interprofessional team who provide care to individual across all practice settings. 2 is education. Those who provide interprofessional and staff education. And number 3, system organization and policy. This can vary depending on the recommendation. It can include administration, managers, government bodies, policymakers, or regulatory bodies. As nursing students, the focus will be on practice recommendations. It is still beneficial to be aware of the educational and system, organization, and policy recommendations as well. What is a gap analysis? It's the difference between current knowledge and practices, so what we are currently doing, and current evidence-based practices, so what we should be doing. Gaps can occur in knowledge, skills, or practice. It is important when you look through this guideline to reflect on the following questions and be specific. Where is our current practice? Where do we wish we were / where should we be? Why has this gap occurred? And how are we going to close this gap? Performing a gap analysis on best practice guidelines is an essential part of reflecting on practice. When reviewing the recommendations, identify where there are gaps in current practice or knowledge and take the time to reflect. Steps to conduct a gap analysis. Step 1. Perform a needs assessment. Step 2. Determine the educational gaps in knowledge, skills, or practice. What is the best practice? Step 3. Determine purpose of the activity and program objectives and design. Step 4 is course development. Step 5, implement the activity. And step 6 is to evaluate the activity. First, we will take a look at the practice recommendations for the best practice guideline, assessment and management of pain. Objective 1 is assessment. 1.1. Screen for the presence or risk of any type of pain on admission or visit with a healthcare professional after a change in medical status and prior to, during, and after a procedure. 1.2. Perform a comprehensive pain assessment on persons screened having the presence or risk of any type of pain using a systematic approach and appropriate validated tools. 1.3. Perform a comprehensive pain assessment on persons unable to self-report using a validated tool. 1.4. Explore the person's beliefs, knowledge, and level of understanding about pain and pain management. And 1.5. Document the person's pain characteristics. This diagram is pulled directly from the RNAO's Best Practice Guideline, Assessment and Management of Pain. This is Figure 1, and it discusses the adaptive pain assessment using the acronym OPQRSTUNV. O stands for onset, P is provoking / palliating, Q is the quality, R is the region or radiation, S is the severity, T is timing and treatment, U is understanding / impact on you, and V is values. How to select a pain assessment tool. Pain assessment tools must be reliable, valid, responsive, feasible, and practical. The tool should also be developmentally and culturally appropriate for the population it is designed for, available in various languages or easily translatable, easily and quickly understood by the person, liked by persons, clinicians, and researchers using it, easy to obtain, reproduce, and distribute, and able to be disinfected if touched by a person. This chart compares the misbeliefs versus facts regarding pain assessment. Objective 2 is planning. 2.1. Collaborate with the person to identify their goals for pain management and suitable strategies to ensure a comprehensive approach to the plan of care. 2.2. Establish a comprehensive plan of care that incorporates the goals of the person and the interprofessional team and addresses assessment findings, the person's beliefs and knowledge and level of understanding, and the person's attributes and pain characteristics. Objective 3. Implementation. 3.1. Implement the pain management plan using principles that maximize efficiency and minimize the adverse effects of pharmacological interventions, including a multimodal analgesic approach, changing of opioids, the dose or routes, when necessary, prevention, assessment, and management of adverse effects during the administration of opioid analgesics, and prevention, assessment, and management of opioid risk. 3.2. Evaluate any non-pharmacological, physical, and psychological interventions for effectiveness and the potential for interactions with pharmacological interventions. 3.3. Teach the person, their family, and caregivers about the pain management strategies in their plan of care and address known concerns and misbeliefs. This chart goes over the interventions regarding pain management and is pulled directly from the Registered Nurses Association of Ontario's Best Practice Guideline, Assessment and Management of Pain. Adverse effects of opioids. Many opioid-naive patients will develop nausea or vomiting when starting opioids. Tolerance usually occurs within 5 to 10 days. Patients commencing an opioid for moderate to severe pain should have access to an antiemetic to be taken if required. The majority of patients taking opioids for moderate to severe pain will develop constipation. Little or no tolerance develops. The commonest prophylactic treatment for preventing opioid-induced constipation is a combination of a stimulant, senna or bisacodyl, and osmotic laxatives, lactulose or PEG. Nurses should be aware of the adverse effects of opioids and should work to prevent and manage when needed. Sedation is an adverse effect and can come about when increasing opioid doses. This can be dangerous as sedation can lead to respiratory depression. Considerations when administering opioids. When a dose is increased, the titration of opioids too quickly, people who have never used opioids, a change in opioid medication, route, or delivery, recent or rapid change in the function of a vital organ, concurrent use of medications that can depress the CNS, and pre-existing factors for respiratory depression. Nurses and the interprofessional team are accountable to frequently monitor individuals using opioids and their response, in order to ensure their safety and avoid adverse effects. This is specifically important for those who have never used opioids before. Objective 4. Evaluation. 4.1. Reassess the person's response to pain management interventions consistently using the same reevaluation tool. The frequency of reassessments will be determined by the presence of pain, pain intensity, stability of the person's medical condition, the type of pain, example acute versus persistent, and the practice setting. 4.2. Communicate and document the person's responses to the pain management plan. Listed below are the education and system organization and policy recommendations related to this best practice guideline for your reference. Objective 5. Education recommendations. 5.1. Educational institutions should incorporate this guideline, the Assessment and Management of Pain, 3rd edition, into basic and interprofessional curricula for registered nurses, registered practical nurses, and doctors of medicine programs to promote evidence-based practice. 5.2. Incorporate content on knowledge translation strategies into education programs for healthcare providers to move evidence related to the assessment and management of pain into practice. 5.3. Promote interprofessional education and collaboration related to the assessment and management of pain in academic institutions. 5.4. Healthcare professionals should participate in continuing education opportunities to enhance specific knowledge and skills to competently assess and manage pain based on this guideline, Assessment and Management of Pain, 3rd edition. Objective 6. Organizational and policy recommendations. 6.1. Establish pain assessment and management as a strategic clinical priority. 6.2. Establish a model of care to support interprofessional collaboration for the effective assessment and management of pain. 6.3. Use the knowledge translation process and multifaceted strategies within organizations to assist healthcare providers to use the best evidence on assessing and managing pain in practice. 6.4. Use a systematic organization-wide approach to implement assessment and management of pain, 3rd edition, best practice guideline, and provide resources and organizational and administrative supports to facilitate uptake. This chart considers research gaps and future limitations in regard to the RNAO's best practice guideline assessing and management of pain.